This podcast is for entertainment purposes only. The opinions expressed in this episode are not to be construed as medical advice.
Welcome to Demystify Beauty, a weekly podcast about creating transparency in the beauty space. I'm McKenzie Westmore.
And I'm Dr. Paul Mintz.
Hi, Dr. Nassif.
Hey, I got to tell you, I'm so excited, McKenzie, this week because I just recently, we've been doing this whole health thing that we've been talking about.
Yeah.
So I just recently had a cardiac, or it's called a CT angiogram of my heart.
Wow.
And I'll tell you, about that in a minute. And so I'm excited because we got my good buddy and my cardiologist, Dr. Dandillaya from Beverly Hills, going to be with us today. How's your week been?
It's been good. Traveling from Vegas to LA, and after we wrap up, I'm getting back in the car to go back.
Oh my goodness. Are you in LA right now?
Yeah, I am. I'm at my parents' house.
I was going to say you're at your parents' house.
Yeah, that's why different background, different headphones. I don't have my headphones. I can't pack up everything.
Oh, well, you still sound good. So
Thank you.
Everyone, I want you all to meet my good friend, Dr. Ram, who not only is a cardiologist, but he's been helping me with pretty much, I'm going to say, some anti-aging medicine.
Really?
Ram, would you say that?
We could call that, sure.
Give us all a little introduction about what you exactly do.
Absolutely. Well, thank you, Paul, for having me on. This is terrific. So I'm an internist as well as a cardiologist. I'm in private practice. Also have an administrative role at Cedars-Sinai. I'm clinical chief of the cardiology department. So
wow.
Private practice and help guide people to, their best path for health.
That's
Love
amazing.
That. How did you get into cardiology?
It was an interest of mine since medical school, just fascinated by the physiology, anatomy of the heart. I was fortunate to have some amazing mentors in medical school and in residency coming to Cedars, which was really a mecca of cardiology. I think several of us were just really inspired by the legends and giants at Cedars. So it was a lifelong fascination that became a career.
Now, to all of you folks that are listening from different parts of the country, Cedars-Sinai Hospital is our big main center in Los Angeles, Beverly Hills areas. I think isn't it one of the top hospitals in the country?
That's right. Nationally,
I think now.
Number 3. Yeah.
What we want to do, McKenzie, why don't you... So we have questions to ask you, generic questions first.
And I also have off the question stuff to ask you, always.
Yeah, I got 1,000. I got to tell you about that. But why don't you start off, ask them some good old basic homegrown questions that you think our listeners will love to hear about a cardiologist.
Yes. I mean, obviously, Dr. Dandillaya, it's lovely to meet you. Thank you so much for joining us. This all falls in the line of demystifying beauty, because beauty is not just external, it's inside as well. So I want to hear from you, what is an appointment like with you? How do you go about heart health?
So if a typical patient comes to the office, we first have them come in, and there's a process of the interview where we spend 20, 30 minutes perhaps really understanding their diet, their lifestyle, their past history. Family history is very important. So it's really information gathering. And depending on how detailed that is, that could take shorter, sometimes longer. One of the things that we do quite a bit of is preventative cardiology. People who've never had a problem, but there's family history. And so we want to elucidate what's going on there.
Me. You.
Me. Very, very interesting. That is fascinating. It's interesting because that heart health is something that has come up more recently in my family. It's obviously been an issue in my family for many, many years. Unfortunately, all my great uncles passed at 40 of heart attacks.
Whoa.
So it is a strong thing in our family. However, my mother was just recently diagnosed with AFib. And for those listening or watching, can you please explain what AFib is? And I'm curious to know how you would go about treating AFib.
Before he answers that, that's what this whole text was about.
Oh, no way.
is about kind of a relative of mine who needs to go in and have a procedure to stop the AFib. And we were talking about what's the best doctor, and because of the blood clotting and all that, and that's what we were just talking about right now. So he was telling, we were discussing.
Well, AFib, you're hearing. I feel like you're hearing it a lot right now. I don't know if this is true, but I feel like I am hearing it a lot in the news, in the media. AFib. So if you could please explain AFib to everyone.
So atrial fibrillation is an electrical abnormality of the heart rhythm, where heart rhythm basically becomes irregularly, what we call irregularly irregular. It's a very chaotic rhythm. So number one, the patients can start to feel it. They can feel palpitations, shortness of breath, feel more tired. Sometimes they don't have any symptoms. The scary part about atrial fibrillation is that there's definitely a risk, depending on other risk factors, for stroke. So this is one of the leading causes of stroke in the country. And now that we have devices, including an Apple Watch, that can detect atrial fibrillation, you're hearing much more about it because there's early detection, which is the key, because there's some great interventions that can be done to either get rid of it or manage the risk.
Interesting. Very interesting. Now, I'm not trying to get controversial here. I truly am not. I just have to ask the question. Dr. Nassif knows me. I have to ask the question. Because we've seen this uptick. Now, I know you're saying with the Apple Watch, but people are throwing it out there.
I know what you're going to say.
You know where I'm going. COVID or COVID vaccine, or is it the COVID infection itself? Are you seeing an uptick because of either of those?
It's interesting. I think for me personally, during the peak points of the pandemic, there were certainly a number of patients coming in for increased palpitations and things like that. But I don't know if I've really seen that trend sort of sustain. And certainly that sort of has quieted down. And I think there may have been some association, but these numbers were not really big, at least in my practice. But there was some concerns about all of that. Again, a little bit of a controversial subject, but I think the vaccines were safe. But for certain people, they did have some of these effects.
Right. But even COVID itself, that's what I heard, that even COVID infections were causing issues.
Yes, there was a myocarditis, which is inflammation of the heart muscle that was certainly there. And again, knock on wood, we're not exactly seeing, a lot of these cases right now, which is great.
Thank God.
I'll tell you something. That's a whole nother conversation about, which is very controversial, of course.
Of course.
Vaccines. Now, when you have a patient, so I have a family history, and just to let you know, as a plastic surgeon, if I'm doing any procedures, I send them to him from the age of 50 on, or earlier if they have, I'm 61, or earlier if they have a cardiac history. For you, normally, between a man and a woman, in age-wise, Ram, is there a specific age for either one?
For in terms of screening or getting a heart
like
program?
A cardiology, just let me come in and get my first echo or stress test or something.
Yeah, does it change for men or women?
Honestly, if there's a family history, I say get in as soon as possible, even if you're in your 20s, 30s, because there is some blood testing that we would do, and we can talk about it. But one of them is Lp(a), which is a genetic test that can be done one time. Really will help us identify if there's extra risk, because statins doesn't lower Lp(a). It lowers LDL cholesterol, but not Lp(a), which is one of the things where you can see risk despite having normal cholesterol.
Wow.
Okay, you know what? You're going to have to remind me and text me later on. I forgot. Do I have that? I think I do.
We'll talk offline. Yeah,
I know. HIPAA. We got HIPAA going on here, Dr. Nassif. You should know better.
What can we do about that? Well, speaking about that, today in the news, and I think he's stable. Bronny James.
Yes.
Is he playing basketball? And again, these kids playing basketball, he had a cardiac arrest or something like that.
Yeah.
Yeah, I didn't read all the details and what the circumstances were, but yeah, our of course thoughts and prayers to the whole family there. These are always tragic situations. Unfortunately, there was what I understand there was early intervention, and between CPR and having a defibrillator close by,
Defibrillator.
these are really what's so critical in all these athletic settings and so forth. So early intervention is absolutely key, and they handled it, I believe, great, and he's stable in the ICU from what
Oh,
I
thank
read.
God. With that, are there any like uncommon signs that people should be looking out for? I mean, is there anything that, we all know the typical signs of like the pain, the down the arm, but what are some things that we maybe wouldn't think to look for?
Yeah, it's a great question. I think classically, we've always described crushing symptoms, chest pain, or elephant sitting on the chest. It could be even more subtle. It could be left arm, jaw pain, shortness of breath. Particularly in women, we worry about more of the atypical symptoms of coronary disease. The presentation has been underdiagnosed, misdiagnosed for various reasons. And we know that, of course, women have different physiology in their coronary arteries, and that the presentation of these symptoms can be much, much different. So we have to be very vigilant. And again, being at Cedars, where there's a dedicated women's heart center, we have some very powerful tools to look at that. So I encourage
Wow.
everyone to sort of look into that and be vigilant of symptoms that are unexplained and try to take it to the next level of testing if needed.
Wow. Now, what are some things that people can do at home just to increase heart health?
Again, great question. I think everyone recognizes the huge role of lifestyle.
Mm-hmm.
Uh, Myself, I'm a proponent of a plant-forward, plant-based Mediterranean diet, which is good. And again, doesn't have to be a 100% vegan diet, but the more we adopt that kind of a plant-based style of eating, and probably also caloric restriction to a certain extent, those are things that are going to extend longevity. And if you look at the populations that adopt this from observational studies, it's pretty compelling, a lot of that data. So reducing processed food, excess carbs and sugar, things that we all know about, but also things like hydrating well, getting enough sleep, very, very critical. The role of sleep keeps getting more and more important in our world, and trying to get more sophisticated ways to look at sleep architecture and how people are sleeping. That's going to be, again, a very interesting targeted intervention for a lot of our patients.
Sleep, interesting.
And you talked to me about it when we spoke. Stress, cortisol,
Huge.
keeping the cortisol level.
Oh, good luck there.
So let me ask you a question about this whole, the cardiovascular aspect. And I remember there's different stages of which you need to have your heart rate up in a certain amount, so many times a week or something. I forgot there was a name for that. What tell us that aspect of it.
Yeah, I think, just kind of high level, you can certainly look at different zones of where your heart rate is. And there's this idea of keeping your heart rate in zone 2. There's different sort of breakdowns within that based on kind of what's your maximum predicted heart rate. But I think what we're recognizing more and more is that you don't even have to necessarily exercise for, strenuous long amounts, but having something daily consistent is going to be excellent. It doesn't have to, and it can be even just brisk walking, but the more you sort of focus on activity. And also the other thing that's important, again, putting on the diet piece is don't forget protein, because protein is really linked to longevity from that standpoint. So this is all important to tie in.
As before, there's a few more questions on that, but, a lot of us think, and I just read some article disagreeing with this, that a little alcohol is not going to hurt you. So from your standpoint, whether it's wine or clear alcohol or stuff, or a couple drinks a week, do we have any good, final thoughts on alcohol consumption?
It's a great question. As you know, wine and, moderate, mild to moderate sort of alcohol intake was thought to be acceptable as part of our Mediterranean style diet. And maybe the thought was with trace amounts of resveratrol in red wine that was going to be helpful.
Yeah.
Again, it's a very, very small amount, but I think really the newer consensus is that any alcohol is probably not going to be good for you. The risk outweighs the benefit. Everyone has to make a personal choice about that, but it's the data is suggesting that it's not the alcohol is just toxic. It's toxicity for the cells.
So even when people talk about red wine, that's still not.
Yeah.
Yeah. What the bummer about that is, I love a good glass of Bordeaux, a good glass of red wine, or even a good tequila.
I'm allergic.
So there you go. That's smart. That's good.
That's good.
And then I just what he just said, I just read about the toxicity aspects.
Interesting.
And so which is a bummer for a lot of us listening. But in addition, when we spoke last year, and the reason why we're talking about all this, so I lost my brother last July 6th. He was 63. He had a lot of the risk factors, overweight, sedentary lifestyle, maybe a little high blood pressure, different things, family history, high cholesterol. And he was in the middle of getting an IV, and I think the woman of fluid overloaded him. And he already had some heart disease and coronary heart disease. And that's what we found out later on. And he died right there. Just died. And I'm still, his birthday was yesterday. And so I'm still a mess about that.
So sorry.
But,
yeah.
So it's funny, is about 3 weeks, well, not funny, coincidentally, but 2-3 weeks before that, I had a cardiac CT angiogram that we talked about. Because I get routine echocardiograms and all this stuff, stress tests. And, it does the calcium score, which shows how much calcium, again, it's another predictor, and also any blockage. Because the old days, we do this angiogram. If you're very sick, and they have to, it's a big, you're going inside the leg, in the femoral vein. And it's a pretty big procedure and high risk. Yeah, they do a CT. So I had a little bit of calcium a year ago, and a little bit of small blockage in one of my blood vessels. 1 at 20, mild. He's symptomatic. And so I called him and I said, just like what we're doing now, cardiac. Try to do the blue zone diet. And that's what he was talking about. Some of these areas that live, the more centurions that live past 100, like Sardinia, Loma Linda, somewhere in Asia, correct, doctor?
Is it Japan?
Japan. I think Okinawa or something like that.
Yeah.
And they do drink a little alcohol, a little wine. They eat a little bit of fish. But he's a vegan, Dr. Ramez. And so we talked about that. We talked about, because, I exercise a decent amount. So do you, McKenzie. Mm-hmm. And we were talking about statins, because I have a family history of high cholesterol. And, he orders a special test to look at my cholesterol level, like this LP(a) and all that kind of thing. And then we try to optimize my LDL, which we have. And then the biggest thing he told me about in my line is because sleep, which I have been, but it's the cortisol release from stress.
Mm-hmm.
And that's one of the biggest things for me. And whether it's yoga, meditation, whatever it is to get it down, a lifestyle change. So I had another one on Friday. Now, you don't get them that close, but I just wanted to see, because of what happened to my brother, a little bit more paranoid, did I get worse? And my calcium score got a little better. And it looked like when I was looking at the flow of the little plaque, that it appeared that the plaque got even a little bit smaller, the soft plaque. And so I've been trying to incorporate God willing, the things that he told me to do. So it's really important, cardiovascular health.
It is. It is really very healthy. And, I would even love for you, doctor, to explain for people listening, because I know what zone 2 is simply because of my Peloton. It tells me when I'm in zone 2.
Oh.
But yeah, Dr. Nassif.
Oh. What is that? Yeah, I want to know too.
So I think it's important for people to know exactly what zone 2 means.
Yeah, I mean, zone 2, and again, there's a table you can just get that has a breakdown of all the, different sort of heart rates. But, again, calculate a little bit based on their predicted heart rate. But, for some people being kind of zone 2, maybe sustaining like around 120, beats per minute, that will be their zone 2 based on their age and their sort of kind of their goal there. There's a formulation. And so staying within that sort of range is kind of an optimum range to sort of enhance cardiac health for various mechanisms. Sustainable. It helps with just optimizing cardiac health. So we tend to stay in that zone because zone 3 you start to have excess, just excess caloric burn. So that's why it's a good range there.
And would you recommend, like, I prefer Fitbit. I do have an Apple Watch, but do you like to have your patients wear, or do you recommend some of the monitors?
Yeah, I think any of these monitors are good. I don't know if I have a necessary preference for any of these.
No, but just to have one.
Yeah, I mean, I think it's good to kind of track it. Again, when I get people on the treadmill here, what I like to do is sort of see kind of how quickly they get to their target heart rate and how quickly their recovery will be. So again, there's a lot of variables around that. And this is where it's kind of helpful to get that baseline to see how much they can push themselves, because if they start to in the first stage of our Bruce protocol start to struggle, then that gives us a lot of information that they should probably slow it down a little bit, and based on the speed and the grade on the treadmill, they have to adjust their workload.
Interesting.
I think it just depends on what people love to do and how they like to move, and find what's good. And again, you can get very, very analytical and methodical. Maybe I look at a little bit bigger picture, but give some loose guidelines on what to do and try to see how they can achieve it. So
it's movement. Yeah. Movement is important. I mean,
for those 10,000 steps important. A day, right?
That's me. I get my 10,000 every day.
Yeah, that's always good.
I mean, it's hard when I'm sitting in here doing this, but so let me ask you a question about the young folks. That's one of our questions.
Yes.
So I just talked to him earlier, and I was texting him, and I talked to him yesterday about I want him seeing all my children, all my boys.
Smart.
So one of my boys, he had some workup, and his cholesterol was a little high. It was 20. So I said, first of all, for him, and I want you to correct me if I'm wrong, I told him to get on fish oil. What's your thoughts about that?
Oh, good question.
Fish oil. Well, fish oil it has a lot of beneficial aspects, certainly. Typically, we use it for high triglycerides. I'd have to remember if he had high triglycerides on his numbers. Fish oil has some additional interesting properties potentially for coronary plaques, which I think, we've discussed, for you also, Paul. Possibly some with high potency fish oil, maybe even some regression. So there's definitely good benefits. Maybe eating more fish, you can derive a lot of it. But the purified fish oil, definitely there's some good benefits.
And I'm on that prescriptive fish oil. I'm on Vasepa. That's what I'm on now. What is that? Just a very purified?
Highly purified, pharmaceutical grade. We've studied these compounds for many years. Again, finally, we're finding some good signals that there is going to be benefits. Maybe a little bit of controversy behind how some of these trials are done, but high level, it looks like there's not only is there going to be improvement in the lipid profile, there's going to be potentially plaque reduction based on some of the recent trial data, and perhaps that there's a suggestion that this can reduce future MI. Again, some controversy in the studies that are out there, but there's an interesting signal that for the appropriate patients, I think it's a good addition.
I mean, it's interesting to me that you do bring this up because I am somebody that I eat healthy, I exercise, I drink my gallon of water, I get my 8 hours of sleep. You know, I try to keep stress low, but that doesn't happen. However, even with a healthy lifestyle, I, a month or so ago, had super high cholesterol, very concerning cholesterol. And my doctor had suggested a statin. I wasn't ready to jump there because I know there can be side effects with that. So I did try the very high level fish oil, and now I'm finally under 200 for what the ones should be. And my doctor, he called me, he said, I'm shocked right now. He was genuinely shocked. And he said, whatever you're doing with, it's great. It's working. It's fairy dust. Great. Do what you got to do.
But now, and again, Dr. Dandillaya might say something different.
Yeah.
But just telling you that is still not fantastic, because remember what you're looking at least with me, what we're looking at is one, the HDL, of course, and that goes up with exercise. But it's the LDL.
Correct. Yeah.
And the
all
LDL,
my numbers got normal, which was interesting. Everything normalized.
But there's no way your LDL is normal if you're just around 200 or just under 200, because your LDL, doctor, is it 90 and below, or what's the new number since it keeps dropping every year?
Yeah, it's a good topic. It's an interesting topic, and I think there's different ways to approach it. And if you do these advanced lipid panels, there's LDL, which has traditionally been called the bad cholesterol. There's HDL, which is traditionally the good cholesterol, and there's triglycerides. The newer thinking is that perhaps these labels are too simplistic. What we should be thinking about is the sum of all the what we call atherogenic particles, all the particles that are going to create plaque. And there's another number called another test called ApoB, which summates that much better, that risk, because we have the risk from Lp(a), the risk from LDL, the risk from what we call VLDL, which is another type of cholesterol. So the biochemistry gets very, very complex. And so ApoB was used to be kind of a niche test, but it's easier and easier to get that ordered. Perhaps a better marker of overall risk than even LDL. But high level, if you're just looking at LDL cholesterol, what we consider low has been getting lower and lower. Essentially every iteration of our guidelines. We used to want to get LDL below 100. Now in high-risk patients, it was like get it way below 70. And now we're trying to get it below 50. And I think in many of our patients, that right number, there doesn't seem to be a lower limit where you take LDL where there hasn't been a corresponding reduction in risk, which is really interesting. And now with the new, what we call PCSK9 inhibitors, which are injectable drugs, we can take cholesterol down to numbers that we never thought really possible. It's really powerful drugs.
That is interesting. Yeah, there you go.
Great.
Now, I read an article, and I don't know if this is true or not, but I read an article that in Europe, their levels of cholesterol, their lipids, all of that were at a much higher allowance than in the United States. Is that true? Do you know if that is a true statement?
I think it's, there's been this concept of the French paradox, where in France there are, the population there has a certain, of course, rich diet, and there's just much less incidence of coronary disease. That was an observation compared to the United States, and I think there were various reasons to account for that. Was it the genetics? Was it the activity? Was it the stress levels with work? So again, I don't know if that's fully kind of teased out, but again, I think if you tease out the factors, populations that have high Lp(a), have high calcium scores, high inflammatory markers, they're going to end up having just higher rates of coronary disease.
Interesting.
So one of our questions is about kids, and I was telling you about Gavin. I want to start having him watch his cholesterol and his, and some of it's again familial, her side of it, his mom's side, my side. And so let's say his LDL is a little high, and he's 20. Taking some fish oil, maybe not, like you said about plaques, maybe it's also good for his brain and, and clarity. But, and again, I always forget the name of this. Can you take a healthy kid, but maybe a little high cholesterol, maybe not the best, and they're already doing a decent diet, not a statin, but can you put them on that, what is the name of that pill that I'm on again?
Zetia.
Zetia.
Yeah.
I mean, is that something that's kind of benign? And how does Zetia work?
So Zetia is a non-statin alternative. It blocks absorption of cholesterol from the gut, both from the diet and from the circulation of cholesterol through the bile. So it's a very powerful medication. It's a great medication, and it can be combined with a statin also. So it's a great synergistic combination that can lower cholesterol much more than just either of those two medicines alone. So the combination works well. So it's an interesting choice. It's a great choice. I think we'd have to individualize it for whoever it is, based on risk and other factors. But it's an interesting choice for sure.
But the side effects are pretty low with that.
Well tolerated. Much. I would say from that standpoint, much more favorable than the statins from what we see in the population.
Now you talk about, younger people, and Dr. Nassif, you mentioned your son, 20 years old. Dr. Dandillaya, what would you say is the youngest age that somebody should start checking on their heart? I mean, what are the factors? Like, what do you consider?
Yeah, I mean, it's a great question. I mean, I think there was recommendations by the American Academy of Pediatrics of doing a screening lipid panel in teens. Because we know that this process of atherosclerosis starts in the teenage years with what's called a fatty streak. So I think you can't go wrong by drawing basic labs. If there's a strong family history, you should maybe think about checking Lp(a) and things like that, because again, you want a kid to be a kid. You want a young person has to live their life, and diet is a big part of that. But I think you start to have to be conscientious about that and learn these habits at kind of an early age.
Interesting.
That's so interesting, because when we talk about that, I think, as I was mentioning, since I have teenagers, and that's why I'm going to bring them all in, McKenzie, so they can all. I think
I might bring in mine in.
And actually get some blood work.
Absolutely.
Now, some of the things when we talk about health, maybe I'm going to use the word anti-aging. And I think you do this, correct me if I'm wrong, but do you do like NAD and ozone and stuff like that?
It's a great question. I put it this way. I mean, these are technologies that I'm interested in. Part of it is because I have a very large internal medicine-based practice. And actually, with COVID, for example, we had a lot of patients that have suffered from different findings, long COVID type symptoms. And so there's a basis, if you look in the literature, of some of these technologies like NAD, ozone, to help. So I definitely have referred patients to some folks that I know that are very knowledgeable in sort of the techniques and the protocols. So the theoretical basis is there. As you know, we don't have large controlled studies for some of these technologies, but if you really read the literature about it, it's fascinating, and anecdotally it has helped several of my patients. But again, that's just a small sample size. But these technologies can be helpful.
Can you just give the audience a very simple explanation of what ozone therapy or NAD?
NAD. You literally took the question out of my mouth, Dr. Nassif.
Yeah, put it this way: it's fairly complex biochemistry, and again, I'm not a molecular biologist or a scientist there, but if you think about the aging sort of the theory of aging, one of the leading causes is that you get dysfunction or dysregulation of mitochondria, which is a component of every cell. And those have traditionally, as you remember, Paul, we consider this the batteries of your cells.
Yeah, the powerhouse.
They're involved, the powerhouse, so they generate something called ATP, which is very critical, obviously, for mammalian life. So NAD catalyzes many of these reactions in the mitochondria. I think there's hundreds of reactions that are very critical for life to move forward and optimally for NAD to be there. As you get older, both the quality and quantity of NAD starts to change. And so the hypothesis has been if you can replace NAD through oral supplementation, through IV, this is going to help rejuvenate and restore these levels. And so
Wow.
the data has been a little bit conflicting, and there's an active area of investigation, even with oral, what we call NMN compounds, to
Yeah.
see how this works. And there were some studies that maybe this can help people in what's called like a 6-minute walk test, but some controversies, and maybe some flawed methodology. So hard to draw conclusions just yet about this, but again, you take a look at folks who are on NAD and see what their goals are. Certainly, there's a large population that likes this and certainly feels that there's a sense of energy and vitality. And again, there's a basis of why this may work. As you get older, less quality NADs in your system.
Interesting.
How does the ozone therapy work?
Well, ozone, I think, is a little bit more complex. There's certain theoretical basis for why ozone can work. Ozone in large quantities it's a gas, as you know. We have ozone in the atmosphere, but this is toxic in larger quantities. The idea is that to give ozone in very, very small quantities through the blood, it's essentially the way you ozonate blood. You withdraw blood, you add ozone, and you reinfuse it. Those are called passes. And the idea is that ozone will activate a counter-regulatory set of biochemical reactions that will be favorable for your body. It'll help fight off, certainly there's been basis for viral infections, COVID. People have used it, of course, for these anti-aging purposes, which again, you have to be careful about. But it certainly has a basis for helping some of these no option patients that have chronic fatigue and other things like that, where there hasn't been, and same with NAD, hasn't been really a medical paradigm that has been helpful for them. And this has been something that has been tried and has been, for some folks, has been helpful. But the idea is with NAD, ozone can actually help with optimizing the ratio of proper NAD levels as well. So again, these are all kind of speculative and theoretical bases. It does seem safe as well, but everyone has to do their own research, consult with their doctors, and see if that may be suitable for them.
Interesting. And when you talk about NAD, do you mean the IV NAD?
Yes.
Because I know
And
that can
IV
take
NAD,
a
I'll
long
just make
time.
a comment. Yeah, IV NAD has to be done very carefully.
Yeah.
People have some pretty bad experiences with NAD if it's not done properly, and
Right.
it's not done really slowly, because you can get a lot of
Yes.
chest pressure and abdominal pressure. So absolutely. So you have to go into that very, very slowly.
Yeah, it's a good 5-6 hour process from what I hear.
Yes.
Wow.
Yeah.
What's the whole, is any of this, or is there something else that helps protect the telomeres?
Honestly, I'll tell you, I think, the whole theory, I think, Paul, you're alluding to, is that, as cells replicate, telomeres, which are at the end of, the chromosomes, they start to shorten, and that's been a sort of a marker of cellular aging. I don't know if that was a very popular thing to check. I know like 10, 15 years back. I believe that methodology for checking cellular aging has not been really more accepted based on some recent literature about, how do you find out someone's true cellular age. But theoretically, the idea was that things that, if you ate a certain diet, if you had a certain lifestyle, you could actually preserve your telomere length. Again, things like rapamycin and NAD, all of the theoretical things could potentially help. But again, I think there's a little bit of lack of data behind a lot of the long-term studies behind that, I think, is lacking. So it's still speculative, I think.
I'm just curious, what are some of the misconceptions when it comes to heart health?
Good question. I think people sometimes wait too long when there's a symptom. Maybe it's like, if I'm feeling okay, I'm really fit on the outside. Everything else must be going on well inside my body. And sometimes that's a completely different picture. I mean,
Wow.
having taken care of a lot of very fit, like muscular people over the years, you'd be surprised when you really do a calcium score. So I think if there's one message out of this podcast, I would encourage everyone is to make sure you get a calcium score, make sure you get your advanced lipid panel done with LP little a and ApoB. All of those things are just, they're simple, they're cost effective, very, very powerful because you can be truly asymptomatic and have a major problem going on. And you don't even have to see a cardiologist. If you have an internist, a resourceful internist, and again, for your viewers, we certainly could give them some links and to some of the labs and places that they can get some of the testing done in Southern California. But
Definitely.
it's very accessible now for them to get this done.
Okay, so now my question. This is my lights went off. Hold on.
Oh.
This is about male health. There's a lot of folks that talk about testosterone. And I know some women take it, too, for health. She raises her hand. When you get a little bit older, you take a little testosterone, but then you have a lot of the younger folks taking it. So when it comes to heart health, protective versus disruptive about testosterone, do we have any, because I'm on low dose myself, because I'm 61, and McKenzie just kind of pointed to herself. Do you have any information about that in regards to the cardiac status?
Again, I think it's a very individualized sort of question. There's clearly, you have to understand, why does someone need testosterone and why are they seeking it, benefit from it? Of course, there's traditional indications. But as a cardiologist, I do have folks that get testosterone from urologists or other sources. Our job is to make sure that blood pressure, lipid profiles, all of those things are proper and monitored carefully. With some of my patients that have had significant cardiac events, you have to be exceptionally careful just to make sure that, because there is some data that testosterone can accelerate soft plaque formation in the coronary arteries. So you want to be careful about that. Having said that, I think there's been some recent data also confirming that testosterone has been safe from a cardiac standpoint, from an MI standpoint, and so forth. I think there was a recent study that came out about that. So I think it can be safely done. It has to be individualized to the risk factors and to the person. But again, everyone has to have that personal sort of discussion and take a look at that.
I got one. It's not along these lines, but I do have a question before we slowly start to wrap up. As I know, a lot of listeners, watchers, people deal with different forms of disorders, panic attacks, panic disorder. I'm somebody that has dealt with panic attacks. Because you feel that crushing in your chest, have you ever found that panic attacks, panic disorders do play a role down the road or at any point on the heart physically, or is it just a physiological?
I guess it really depends on the individual. I think certain folks have just a lot of stress and they're maybe prone to having those kind of panic attacks and palpitations and so forth. Certainly treating that appropriately with, for example, with like beta blockers can be very, very helpful. And that can have a lot of interesting heart effects that can be comfortable. But those people really should be treated and screened, aggressively and appropriately for cardiac risk. Absolutely.
Yeah, because it sure does. It feels like a heart attack when you're in the midst of a bad one. It can feel like a heart attack.
Absolutely.
What is your favorite part of your job?
Great question. I mean, I'll say it's something that through the pandemic, I really reflected on the profession of medicine quite a bit. But I'll tell you, every day is unique and interesting. And I get to meet some of the most amazing people in all walks of life. And we really get to make some of the biggest impacts they've ever had in terms of their health. And I think it's such a unique opportunity to be able to sometimes connect the dots, solve a problem, whether it's cardiac or otherwise. Sometimes it's just a matter of listening through and understanding kind of where, what the real problem is. And sometimes it's not a medical issue. It could be something at home or a social issue, so forth. So I think the exciting part is that we have all the resources and tools, being where we are in LA and at Cedars, and to be able to work with such a talented group of people at Cedars-Sinai, on the administrative and professional side, it's amazing. So I've been quite blessed with that.
Isn't that beautiful? I mean, that's actually fantastic to hear. Well, I think our time is up.
Yeah.
It went by really fast because
it did.
Because we have some great stuff. I mean, this is something that's absolutely wonderful, talking about
it's a wealth
longevity
of
and heart health.
And absolutely.
So we want to thank you. And by the way,
thank you, Dr. Dandillaya.
I don't know if people want to find you. What's the best way for them to find you? A website, a social media, office number?
Yeah, I've kept kind of a low profile on social media. I need to take your cue a little. I do have a website. You can certainly Google our information. Again, happy to post that up as well, for you guys. So yeah, happy to help people and, see how we can guide them the right way anytime.
Fantastic.
Everyone, that's Dr. Ram Dandillaya talking about, again, heart health and just other aspects of a little bit of longevity, and which has been wonderful because we talked about the heart, and especially with the two of us, McKenzie and I, we both have our own little kind of hopefully small heart issues. And this has been a wonderful hour. Anything you want to add, McKenzie, before we sign off for the day?
Oh, gosh, there's always so much I want to add, but no, we got to sign off. But Dr. Dandillaya, thank you so much. This has been amazing. I think our viewers, our listeners will take a lot from this. I invite anybody that is watching or listening to post your questions. Please like, subscribe.
Yes.
If you have more questions on heart health and longevity, don't hesitate to ask. And join us next week on Demystify Beauty.
Thank you all.
Thank you, everybody.
Thank you.
Thank you for listening to Demystify Beauty, produced by Gotham Production Studios. If you have any questions for future episodes, please don't hesitate to reach out to us on Instagram at Demystify Beauty or email us at demystifybeauty@gmail.com. And don't forget to subscribe, rate, and review the show. See you next time.